Good morning, everyone. Am I audible?
Yeah, Maulik, you're audible.
Okay. Once again, dear all, a very good morning and a very warm welcome for joining this webinar on building your sales force of tomorrow. I'm very much sure that all of us would enjoy this webinar as it will answer some of the very important questions of this industry, like keeping the sales representative motivated, how they can deliver high value to the customers and consumers, and how they can become performing teams, best performing teams with the help of artificial intelligence, neuroeconomics, and behavior science, which will ultimately lead to boosting sales productivity. Sorry. Let me give you a quick introduction on the speakers we have today. So we have Ms. Gauri Chaudhari with us, who is the co-founder of brand Innerworld, and she comes with 27 years of experience in the healthcare industry. She has also been training and coaching marketing teams in pharma industry for the past 15 years. Her company, Brand Innerworld, is a healthcare brand consultancy that specializes in creating and building healthcare brands. Gauri has also authored the book named The Perfect Pill, 10 Steps to Build a Strong Healthcare Brand. The second speaker that we have on our panel is Mr. Ramesh Srinivas, who is the founder and CEO of WorkZogo. He comes with decades of consulting experience, and he was a part of leadership teams in multinational firms like PwC, KPMG, and IBM. WorkZogo is a technology company whose proprietary artificial intelligence coach called Mia boosts sales productivity using behavior science and neuroeconomics. WorkZogo uses behavior concepts like persuasive mechanics, nudge theory to bridge the gap between intent and action, and help sales representatives develop productive work habits that deliver better outcomes. So, dear all, we will have speakers talk for 40 minutes, which will be followed by a question and answer session for 20 minutes. Whenever you have a question, just type it on the questions pane that is visible on your window, and it will be directed to the speakers. Once again, a very warm welcome, and let's enjoy this. Over to you, Gauri ma'am.
Yeah, thank you so much, Maulik. Good morning, everyone. And I'm really thankful to you for having me on this panel. Before we actually start how we increase productivity, how do we keep Salesforce motivated, I thought it might be a good idea to set a context. What has changed in past few days? Maybe what has been always changing for so many days? Who got it right in terms of pharmaceutical engagement with doctors, and why did they get it right? And what are the traits of the future salesperson? And maybe after that context is set, Ramesh probably will have very insightful ways of actually engaging Salesforce through neuroeconomics, AI, and the wonderful Mia that you have. So basically, everyone is knowing that lot has changed. But what has actually changed for healthcare industry is there is a journey towards new normal. Probably, there were a lot of concerns to begin with. There were solutions. And again, from the solutions, there are some concerns here. So basically, if we look at the changes, they have happened at consumer and patient levels, doctor levels. The pharmacies, very interestingly, have changed, and pharma brand sales and marketing teams have changed. Just to quickly figure out what changed with, even at the cost of maybe repetition, that what has changed with consumers and patients is that at the attitudinal shifts have happened. I wouldn't really say that behavioral shift probably have happened, but yes, in terms of attitude, health has gained top of mind. A lot of preparedness in terms of health is happening. People started hoarding, in fact, some of the medicines. A lot of those medicines were preventive medicines, and the wellness care came into the picture. We also saw increase in insurance policies being sold off. So there is this concern there. Some of it probably, which was an easier one, got translated into action, but some of it is not really so far. So maybe in terms of behavioral shift, what has happened is that, like all of us have realized and wonderfully well, is that physical presence is no more important. All of us are actually sitting here in this webinar without any geographical barrier, without any, having really stretching ourselves out of our current situation and attending something. So it has really worked pretty well. And what has worked for us has also worked for a lot of patients and doctors. And a lot of it is also for e-pharmacies. They have really stretched themselves out. They have, in fact, like SARS made e-commerce happen in a big way. Probably this is that moment for e-pharmacies today in India, who are struggling so far, but they have done their bit wonderfully well. In fact, they also provided e-consultation platform and fulfillment of prescriptions, and that's something really remarkable and may stay here. So what were the concerns with HCPs? I mean, past 3 weeks to 4 weeks, we all are extensively talking to doctors, understanding their concerns, and what probably has really comes at the top of everything is that fear of corona. To begin with, everybody was wondering what should they do? Are they already infected? Is there any way to figure out? Some of them went on prevention. Hydroxychloroquine was taken as prevention by some of the doctors. Unfortunately, we lost 2 doctors to that kind of fear. I mean, doctors who actually didn't succumb to coronavirus, but to the solution of it. So IPA, OPPA, and various organizations actually went out and told doctors, don't experiment, don't take it unless necessary, and the guidelines were put. Everyone, I mean, every pharma company today is wanting every pharma professional to give a message out to everyone that don't just take it, casually. Another thing that really worried doctors is that lack of patience, because while the corona fighting HCP segment was out there working 24/7, there were non-COVID-19 treatment doctors basically did not have enough patients. And actually, some of them did go to their dispensaries and their consulting rooms, but there were no patients. So lack of patients and absolutely not having anyone out there was a concern for a doctor. Another thing which is playing on their minds right now is loss of patience, which means is that a patient who was with them before corona may not come to them afterwards. The reason being that every patient probably maybe of a chronic ailment or diabetes, cardiac problems, have found out a solution to reach out to some doctor, whoever was available, and may continue to stay with that new doctor or new system. So that's what is bothering some of the doctors. There is concern for patients. Everyone, particularly diabetologists I spoke with, they were saying that I don't know what's happening to my patient. Are they eating right? They are definitely not exercising the way I had told them, and as such, that is so difficult to make lifestyle changes with lockdown. They're concerned and they expect some severity of situation or the condition that would happen once the lockdown is over. Another worry for patients all the doctors had was the unfulfillment of prescription. Now, some of the brands are not available in the market, and doctors are bombarded with questions. Doctor, this is not available. What do I do? Do you have any answer? So that's what is across the specialties. Doctors are struggling, kind of trying to help. And of course, as I said, severity of condition, they are expecting some patients may come back to them with slightly severe problems. The biggest worry right now doctors have is the financial burden. Most of them have their dispensaries or they have their consulting rooms for which they are paying rent. If it's a diagnostic or a path lab, they are paying their staff, they are paying for the the fixed costs, and they are wondering when is it going to end. So this financial burden and sustainability particularly is what is bothering them right now. So what has changed? So these concerns also came up with some solutions. We know that Telemedicine Society of India was launched 18 years back, and they were encouraging doctors and patients to go for telemedicine. Unfortunately, it did not pick the way it should have picked it up. But right now, TSI and MCI together have come up with enough guidelines and directions for doctors to actually start seeing non-COVID patients or even COVID patients in an e-consultancy manner. Though there are better platforms available and with very clear understanding of how telemedicine should work, what patients have quickly done is they have picked up their phone and they have started talking to doctors, and doctors are now allowed to do so, and they are also their prescription, that their e-prescriptions on WhatsApp are accepted, and these are legal prescriptions. So that's what is happening. Some doctors who were ahead of the curve actually moved on to better mobile and web-based platforms which have better diagnostic tools available, and they are comfortable. So there is learning happening, and there is certain kind of earning also happening, though many doctors are actually wondering how would they charge their patients, because they are so used to actually seeing patient face to face and then charging for that time. Right now they are struggling with it, but some of them have figured out the ways around it. So actually the TSI has been told by Government of India that they should be training 5 lakh doctors and in the coming year for telemedicine, and it starts from basic guidelines and basic there can be certain amount of medico legal hassle here because there's a protocol to it. It is not that you have just consulted a doctor, the patient has to be recognized, and those kind of things. Also, what kind of technology is really necessary for diagnosis, and then how do they manage patient remotely? And this is what there is learning curve happening. Definitely for TSI, it's a huge task. So partnerships are needed in this situation for the on-ground implementation. And things may not immediately change after lockdown. We are not going to have patients coming and crowding waiting rooms. So telemedicine is here to stay, and doctors and the organizations do require some kind of help and partnership there. So what has changed for pharma sales and marketing? I mean, I think the first and foremost, everyone was concerned that, am I missing out? So there was that fear of missing out. What other companies doing? What are they doing? After that happened, knee-jerk reactions. I think simply sales representatives started sending messages to doctors, and doctors simply pushed them back, because what you would do face to face is not accepted by any other medium in the exact format, and doctors felt bombarded, and they felt it was irrelevant for the given time and the given situation. So there was this perception that doctors don't want pharma companies to stay in touch. But the reality is that fruitful engagements actually were welcomed wholeheartedly. In fact, if we see Equia's report on the market research report that they did with 500 doctors, it very clearly says that doctors are welcoming WhatsApp, they welcome emails, and a lot of webinars and seminars are being welcomed. But having said that, only those webinars worked which were actually engaging doctors into something that doctors were interested. And many webinars actually in past 1 week went absolutely empty, because doctors would say, I have 15 requests and which of this I should be attending. So anything that caught their attention, which was relevant to them, happened, and anything that was kind of a push for them, they simply rejected. So not very different from what happens otherwise in doctor's clinic. So who got it right, and why did they get it right? So those who had their ears to the ground and those who had empowered field force to hear those nuanced feedback of the doctors got it right. And those who probably did not have that struggled initially, definitely, and over a period of time they are learning it. But definitely those who listened properly and those who had fantastic relationship with the doctors through field force have seemed to have done fantastically well. So one wouldn't say that companies got right. Some of the companies, of course, got it right. But within companies, some divisions struggle to get good engagement with doctors, while others beautifully entered and they have actually built brands over a period of time. So at places, it is divisions, maybe some brand managers got it right. And at places, simply the sales representative got it right. So there are multiple layered approaches, and it's not that one as a whole actually got answer right. And why it happened? Because their ears were to the ground, and very importantly, motivated sales force who ensured the last mile implementation. In a way, if we look back at the hindsight, everything is known to us, clear to us, but that implementation is very critical, and some of the companies actually manage that. So while marketing people thought segments and created strategies, the salespeople actually thought of individual customers and they actually tuned it to the requirement of customers. So relevance and definite action is what worked well for those who could actually manage to engage their customers beautifully in last 4 to 5 weeks. So basically what we see, there are three types of brand in our industry, new category brands, categories and the brands within those categories obviously took help of science because there was a lot of new thing to say through webinars, video meetings, scientific mailers. Some of the high involvement therapy areas where there was nothing new to talk about in terms of therapy or in terms of molecules used patient support platform. They help doctors help their patients. And some of the non-involvement categories like maybe cough, cold, or maybe antibiotics, which are there for quite some time, they did something interesting, relevant and unique. So just to give some example, some companies actually gave COVID-19 kits, and I was talking to doctors and they're so thankful to them because doctors really needed basic gloves and masks were not available initially. So companies who did that, doctors are thankful to them. Some companies actually had helpline numbers and they said, just call if you have any difficulty, doctor, and doctors appreciated it. Though a lot of sales representative actually called doctors and said that if doctor, if you need something, call me. I am here to help you within my own capacity. So it happened for in some cases through companies, but in many cases, actually the representatives took it up on themselves. And in the end, when this whole game is about relationships, doctors really valued this kind of help. And I'm sure that built the relationship further. Calls for sample was another thing that happened. A lot of doctors did say that they need some kind of samples because their patients said they are not getting it. It happened a lot in area of psychiatry and neuropsychiatry. Reason being, as such, getting those medicines in metro places is very difficult. Not every medical shop is generally ready to dispense narcotics or hypnotics, those kind of medicines. You heard those patients when were running out of it with such high level of anxiety. They called medical representatives and they said, can you arrange for it? And they requested for samples, so it worked. Some companies actually launched a stock app for chronic ailments. Now that was a very strategically great initiative because if a particular medicine is not available in particular area, the representatives actually navigated and helped doctors and patients to let them understand where stocks were available. So that was another great initiative. Webinars which worked very well for low involvement categories were medico-legal webinars. A lot of the doctors these days are concerned and are of course interested in this topic. Financial management is another one which in my understanding has really done well. A lot of doctors with these issues of sustainability are keen to know a little more about this, and equity analysis seminar. So that is what has done well and kind of has built relationship with the company and of course the sales representatives. Some representatives very interestingly did videos for patients through doctors. A lot of doctors were bombarded with the same questions. And these reps actually told doctors that why don't you simply shoot a video? I will edit it, I'll word it, I'll put a subtitle to it and you send it to your patient. So those kind of innovative ideas from representatives worked very well. Digital tips for consultation, given the fact that we have young sales representative field force and slightly older doctor segment, this combination worked very well. Given the advantage of age and generation, these representatives were really good at doing this and they added value to doctors' practice, or rather e-practice. Also what worked was emailers and webinars on issues like what, when and how of clinical practice in COVID and immediately after COVID-19. What comes first? Is it the patient or the self-safety and the safety of society in general? I know a lot of doctors today are saying that the buildings in which they have their offices are telling them not to have patients coming to those buildings for next 2 months because none of the buildings want to take that kind of risks. Post-lockdown exit policies, how should they work around it? And of course, patient management. So last mile helping through sales representative in actually identifying and resolving some of the issues has helped. Some of the international trends, if we look at what happened internationally, particularly in Western countries, which faced COVID-19 slightly before, and what role did the field force play? So what worked very well for them is e-detailing. All this while every company wanted e-detailing to work and doctors were resisting. Today, doctors are demanding e-detailing. The kind of detailing they liked were done by self-representative. And I'm quoting this from Ipsos survey. Ipsos has done it across 5 countries, and they have done it last week of March to first 2 weeks of April. And they figured it out quantitatively that what worked was the sales reps who actually came for e-detailing or the medical department person. They didn't really want anyone else doing it for it. And the reason somewhere, in my opinion, is that doctors do want to see the representatives. Even here in India, I know 2 diabetologists who have actually started WhatsApp group for the sales reps of various companies. And they say, oh, hey, I'm missing you all. How are you all? So I don't want to generalize it, not that everybody wants it, but there is a psychographic segment of doctors, and I'm talking about 2 big names in this industry, the diabetologist in the city, who actually have created this WhatsApp group telling representatives, hey, come tell me what's happening in your life. We are missing you. So I'm not surprised when Ipsos figured it out that a sales rep talking to through e-detailing is something that is welcomed. So video conferences and phones have worked. So first is the video conference, followed by phones. What doctors really liked was the scheduled calls, a call with new information, and on an average, every e-detailing went on for 10 minutes, and that's huge. Of course, we can say that relatively doctors are less busy with patients right now, so one can say those 10 minutes can also be attributed to it. But well, I mean, e-detailing is something that doctors have really welcomed. Another thing is that they actually, what worked was dialogues. So many times in clinic, in person, doctor detailing is more around the material. But here what doctors really enjoyed was the dialogue, and who could do this dialogue was welcome more frequently than the other. And dialogue was around patient types and treatment issues. So in the Western world, this is what worked wonderfully and is reported by Ipsos. So what are the sales traits of new in this in this particular times? What is it that working? So it's not the push but the pull. Telling doctor I have something interesting to say, something relevant to say, and actually asking him for scheduling appointment. And if he is ready to schedule it, then working around it has worked pretty well. Customer intelligence, that's very critical. I mean, today we have technology which can tell us what is the area in which doctors are interested. Uh, in fact, I read one case study where, which says that currently oncologists are trying and understanding the relationship between, they're actually trying to understand more about obesity. I mean, I wouldn't say the relationship, but they're somehow very interested, and they are actually on the web. That is what they're figuring out. Now, if you have that idea, you exactly know what is interesting to your customer, and it's not very difficult in today's time to understand. So having that customer intelligence, being digitally savvy, and then of course more of dialogue and absolutely no parroting is what is going to work. And these particular traits have helped internationally. Less frequent but much longer, deeper, richer interactions are happening. So looking forward, both at local and global level, we can actually expect some lost demand, but there is also this pent-up demand. There's a possibility. A lot of patients are going to go and visit diagnostic centers and their doctors, so there might be pent-up demand, and they'll have issues related to how to handle it within the social distancing norms. Severe representation of symptoms may happen, and maybe we'll see second line, third line treatment options coming into front. There would be pent up surgeries because a lot of surgeries got cancelled, and there is a possibility of that may increase. There's a good chance that there will be a change in brand prescription, while or maybe of the same generic or maybe of something else, but there's a good chance of in a chronic situation that patient has simply switched a brand because the brand on which he was managed is not available anymore, and may stay with that brand for longer period of time, the new brand. There is going to be decline in immunity suppressing therapies because overall doctors are saying that they will stay away from them. So we can expect some of the drops in, steroid prescription or, similar categories. Immunity builder prescription is going to go up because patients are going to demand again. They have tried and done something in last 15-20 days, but they are going to, ask doctors that should I have this or should I have that kind of thing. That will go up. Emergence of new technology platforms. I think wonderful work done by some medtech companies, but because they don't have this last mile connect with the doctors, they are failing. They are not reaching out, but they have some wonderful things to offer to doctors, both for e-consultation as well for patient management. And that's those who are active and slightly ahead of the curve doctors are going to lap it up. So any one wanting to help this synergies to come together is worth exploring. And there's going to be remote diagnostic, which is going to stay here because it also works economically very well for patients, doctors, and overall for the expenditure on health sector for the government. So if we look at what has worked, so definitely relevance has worked, and through known face. So building relevance for the brand through a known face, which is the medical representative, has worked. Also, we have to look at this relevance through two windows or two openings. One is that in terms of content, have you given the content which is required? And secondly, has the technology come to your rescue in this particular period? What I mean is that what are the key concerns of doctors and their areas of interest can help for development of content. But simple things like email IDs and mobile numbers of the representatives can actually take brands to another level, because we have been telling our representative to collect this kind of information, but I still understand best of the companies today do not have 100% data of emails and contact numbers of doctors. Now, if we have had it, we could have used technology to the best possible use. We could have actually traced some of the footsteps of the doctor on various platforms. So a lot can be done if these basic things are available to us. Of course, within the framework of social responsibility expectation, but that's something needed. And those companies who manage to get it are definitely ahead of the curve. So in-house customer intelligence, if it was available, or could be the sales rep who are in contact with doctors and actually get all this even now, will take brands and the companies to another level. Is this something that COVID-19 changed, or was it already changing? The answer is no. A lot of it was already changing in terms of we always knew that we needed to add value and we have to be relevant in doctor's clinic. Digital ways of consulting consulting patients was always there. Digital ways of marketing were always there, and need for new age representative was also there. The thing was that those companies which were actually ahead on this curve were ready to reap the benefits, and the rest probably struggled in this journey. So the winners basically were those who were brand ready, whose brands were strong brands, the brands which were built on fundamental principles, those who were technologically ready, those who had even the basic things about the doctors ready. They were technologically, ahead of the curve. And of course, those who were rep ready, who were ready with their representatives, who were empowered, who were ready to act and implement. So the new traits of a salesperson in the coming times, and that's going to stay here because it is not only COVID-19 which has changed it, but in fact, these are the traits a future salesperson must have. And more than a salesperson, he is going to be the chief coordinator officer of the health for the brands, because he has to navigate through various activities that would happen and that would be actually making doctor get engaged with the brand. So he must be aware of various interactions and the events SCP has experienced, and use them to tailor the sales call to the physician's unique situation and preference. Like I said, marketing department thinks segments, but very importantly, that last mile customer understanding and delivering the call is in the rep's hand, and he has to be extremely empowered for that. Probably he must know the interests revealed through the dialogues. He must know about the social media footsteps, and of course social media footsteps will be sent by the HO to this particular representative is engaging with the doctor. But all this information is available to him, and he has to make best use of it. So maybe the conferences he attended, his reactions to the conference and seminars, promotional material, various digital campaign company might have done, and how the doctor actually responded to it. All this information together is going to help him build this dialogue. Well, it's easier said than done because knowledge and data is always available. What one requires is empowering the sales force, but beyond that empowerment, there has to be super nuanced implementation of it. And for that implementation to happen, behavioral modification is very critical. So it's not only whether we know it, but is it in the end happening in the field? Because only if it happens there, we will see the result. Is the field force ready? And I would not generalize it. I would say it from my little experience in last 3 weeks to 4 weeks. In terms of skills, attitude, motivation, and behaviors, are they really ready? So there is this bit of a problem right now. Sales representatives are kind of going through, and I got so many calls, and I got through social media, many representatives expressed something that which they were little not really comfortable sharing with probably their higher ups. And once again, I'm not generalizing it. I'm talking from the perspective of those who reached out to me. I have seen in 90s, we had actually doubling up of field forces. And then came the last decade where everybody started talking about, is it really worth? Is it giving me ROI? And all these representatives are privy to these discussions that increasing field costs, diminishing ROIs. And am I really worth it? Or, am I really needed? Is my territory important? And that's the question. We also know that a lot of digital strategies are deployed in the industry, and some of them do not include reps. Once again, I'm not talking about all, but there are representatives who feel threatened. They feel that, am I really needed? I mean, if there's a better way of doing it, then, am I really needed? A lot of restructuring and downsizing has happened, and unfortunately some of it happened beautifully and some of it didn't happen that well, just with 2 or 3 months salaries. And we have ample of examples today where downsizing didn't happen the way typically it could have happened. There is a huge pressure for target achievements. We all know the suicides which have happened, the depression that Salesforce goes through. So this is the situation right now out there. And on the top of it, now we are saying that there is COVID-19 and again targets, incentives, and future that is at stake. I understand a lot of companies are giving incentives. They have restructured incentives. I also know that certain CUF formulas and some vitamins and minerals have done well. So somewhere overall targets are achieved. But yet, has it taken away the fear from salesperson's mind? No, it hasn't, probably, and that's my understanding. Secondly, there is this insecurity, which is always, am I really needed? So right now, probably the need is to get best out of the rep. So it's not whether we are trying to replace him. No, that probably is not an answer, because internationally, if there is anything to learn, is that this sales representative is very important and is the one who engages doctor very well. So question is, how do we get the best from him? How do we get that additional value from the same field force? And not by adding pressure, but supporting him, letting him do what he's supposed to do and ensuring he does what he's supposed to do, by helping them out and making them do it better. So how do we do that? I mean, of course, all of us have answers, but maybe there is something interesting that can help, and that's neuroeconomics and maybe artificial intelligence, and it's here to help. And Ramesh is expert on this. So I'm giving it to you, Ramesh. I'm sure, everyone is more eager to know from you how we can actually improve sales excellence and effectiveness. So thank you so much.